This presentation is going to cover some chest pain and cardiovascular type of emergencies. Probably going to go in a little bit more depth than what we would need for first aid, but I think just having a good background on this. And cardiovascular emergencies, cardiovascular disease is one of the leading causes of death in the United States, so I think it's important that we understand this because at some point you will probably come upon someone that has some chest pain, and knowing what to do is important. In medicine, we call anything with any heart problem an acute coronary syndrome. So this is kind of an umbrella term of many different conditions. And these conditions include things called angina, which is just simply chest pain, myocardial infarction, which means part of the heart is dying, and we sometimes call that a heart attack, cardiac arrest when the heart stops beating, heart failure when part of the heart is damaged and just does not pump properly, hypertension or high blood pressure, and then also an aneurysm, and that means that one of the blood vessels has weakened and ruptured. Arteriosclerosis is kind of a broad term, and it's oftentimes interchanged with atherosclerosis. Technically, atherosclerosis is a certain type of buildup of fats and calcium inside the arteries, causing a narrowing, where arteriosclerosis is just a broader term, which means narrowing of the arteries. But we use these terms interchangeably. Angina and a myocardial infarction or heart attack present very similarly and actually are really hard to tell the difference out in the field away from all the sophisticated equipment that they have at a hospital or in an ambulance. But I'll try to explain a little bit about the two. So what happens with angina is if you look in the box there with the four circles, you'll notice that in the upper left one, it looks pretty open and clear. And if you imagine that's the inside of one of your arteries when you are young. So when you're born, you haven't eaten all the good tasting food like donuts and pizza and stuff, so you haven't clogged up your arteries yet. However, as we eat, we get a little buildup of fat and plaque inside, and over time that becomes narrower. So if you look at the lower left side, you'll see there's actually a very small lumen or opening there. And sometimes we will do something like go out and mow the yard or shovel some snow or do some exercise, and we can't get enough blood flow through that little opening. And then that causes the heart to hurt, which is really what angina means. It just means heart pain. Now, if you look at the lower right, you'll see that a clot has formed inside that and all the blood flow is blocked. And that is what happens with a myocardial infarction or heart attack. Everything downstream from that blockage begins to die, and that is the infarction, which means heart cell or cell death. And this can be seen on cardiac monitors. It oftentimes is experienced with a very crushing, heavy chest pain and a little shortness of breath. Sometimes the patient will look very pale. The next slide will show some different signs and symptoms. I'm not expecting you to memorize all of this. You can see the difference between the two by looking at the slide. And to be honest, even me as a paramedic, it sometimes is very difficult for us to tell the difference in the field just by the way the patient presents. But when we have someone that is having chest pain, heaviness, squeezing, tightness that oftentimes will go up to the shoulder or neck or down the arm, even through to the back, we tend to think heart attack because heart attacks are so common. This is something that we see all the time. They will usually look a little pale and a little sweaty. Gray is kind of a color that we associate with someone having a heart attack. And when they sit down and rest, if it's angina, it typically will go away, but with a heart attack, it won't. And that may be one way that you could tell the difference, but do you really want to risk saying something is angina when really truly it is a myocardial infarction and their heart is dying? So we always recommend that you go to the hospital and get checked out. There's a couple of groups of people that experience heart attacks or myocardial infarctions differently, and those are elderly because they typically don't feel the pain as much. So you may see some sweatiness and grayness and a little shortness of breath, but they don't have the pain. Diabetics oftentimes don't feel pain the same way, so they may not have pain with a heart attack, and women oftentimes don't have severe chest pain. They have more of an abdominal discomfort, shortness of breath, and feeling real weak and tired. So those patients have what we sometimes call a silent MI, meaning they didn't have the heart attack, or they had the heart attack, but they did not have the chest pain that goes with it. Just putting this in just for kind of trivia purposes. But it's kind of interesting that in the morning after we get up, and typically on Monday mornings when we get up, is when we see most heart attacks in this country. They're a little more common in winter months. Um, and we don't really fully understand the whole Monday morning thing, other than that's when we have to get up to go to work. So a lot of times we're feeling a little more stressed and maybe we didn't sleep that well. And it's just something that seems to happen. Although a heart attack can happen at any time. Now, as we get older, we tend to see more heart attacks just because we've had more time to eat the good tasting food that clogs up those arteries. There is a lot to be said for the genetic component to this, and I think that has a tie-in with cholesterol. So if everybody in your family has had heart attacks, you're probably going to have a heart attack. And we do see it happen in males more than females, although it is very common in females also. And it tends to be a little bit later in life for females than males. So we might see males begin to have heart disease and heart attacks in the 40s and 50s and 60s. Women, we tend to see more in their 60s and 70s, although it does happen to both genders. Now, you can't really do much about your gender, your age, or your genetics, but these are some risk factors that you can control. And we see that people that smoke have a higher risk of heart disease and heart attacks, high blood pressure, which you can control with diet and exercise and medication. Keep your blood cholesterol levels under control, and there's lots of good medications. In fact, cholesterol medications are, I think, the most commonly prescribed medication in this country. Being a diabetic, although you can't control being a diabetic, but you can control your diet and exercise levels to keep your blood sugars under control. And obesity, as I mentioned earlier, again, exercise, physical inactivity, again, more exercise, and stress levels. And that can be changes in jobs, having to cut things out of your life, plan your life better. There's all sorts of things you can do to try to reduce stress. And this class is not really designed to be a stress management class, but reducing these risk factors will reduce your risk of having a heart attack. Well, there's really not a lot we can do to fully treat a heart attack in the field or as first aiders. There are a couple things we can do. First, have the patient sit down, rest for a moment, and call 911 and let the ambulance crew come and take care of them. While you're waiting on that, one of the things you can do is you can ask them if they have any allergies, and if not, you can have them take 4 baby aspirin or 1 adult aspirin. Now, if they've had a heart attack before, they may have a medication called nitroglycerin. We'll talk about that in a moment. Otherwise, just keep them calm. You stay calm. Wait for help to get there. You can ask them some questions about how they feel and all that. Try to get their medical history together, some of their important information about allergies and medications and past medical history and name and all that. But generally, just have them rest and get them aspirin. As I mentioned, aspirin is one of the things we can do to help. Now, a lot of times we take aspirin because we might have a headache or we feel like we have a fever. And that is not what the aspirin is going to be doing here. So don't give them an aspirin and ask a couple minutes later to see if their chest pain's any better because it's not like a headache. It's not going to get better. What we're really trying to do is, if you remember that clot that was forming inside the artery, we're trying to limit the size of that. And this has been shown to be extremely effective and one of the best things we can do. Now, I like the baby aspirin just because they tend to be sort of orange flavored and taste pretty good versus chewing up an adult aspirin. But whether it's an adult aspirin or baby aspirin, we're going to give them the aspirin, have them chew it up and swallow it. Chewing it up breaks it up into small particles, so it gets absorbed a little bit faster. You also want to stay away from buffered aspirin or enteric coated aspirin. These are aspirins that people take regularly, like daily, that try to prevent ulcers from forming in their stomachs. So just regular baby aspirin. Sometimes you'll see it as cardiac aspirin or 1 adult aspirin, have them chew it up and swallow it. Now, if you're not comfortable doing this or you're not really sure, that's okay. Make sure 911 has been called, and when the ambulance crew gets there, uh, we'll go over it with them and give them some aspirin. Nitroglycerin is a prescription-only medication, so a person is only going to have this if they've had heart problems before, they've talked to their doctors, and they've been prescribed this medication. And typically they take one pill every 3 to 5 minutes when they have chest pain. And if the chest pain is not better within 5 to 10 minutes after taking 2 to 3 of these pills, they're supposed to call 911. So generally, we don't want to have them take more than three and never more than one at a time because it does dilate blood vessels. And anytime all your blood vessels dilate or get bigger, your blood pressure drops. So if taking too many of these, you can drop somebody's blood pressure very, very low. Now, as a first aider, you're going to run into this probably even more than me on the ambulance as a paramedic, because people are real hesitant to want to call 911, and there's lots of reasons for this. Sometimes they just feel like it's going to go away, or they didn't think it was bad enough that it wasn't really a heart attack. It was maybe just something they ate, so they're in a lot of denial. And it's interesting because denial is a sign of a heart attack. People do worry about other things like how much is this going to cost? Do they have insurance or not? And if they don't get treated, there's a good possibility they can die. So I, I don't know if the cost is that important, but it is something I know people worry about. They're afraid to go to the hospital, especially right now with COVID. This is just kind of a hoopla, big deal, and they're kind of embarrassed by it all. They don't want their neighbors to see the ambulance and worry people. So they oftentimes don't want to call for that. And sometimes it's just flat out denial. They don't want to admit that there's something wrong with them. I know we're going to cover CPR in the CPR module, but I just wanted to mention because it is related to heart problems. And a lot of people confuse a heart attack and cardiac arrest. And they're two different things. A heart attack is when your heart muscle is dying. A heart attack is when your heart's not beating properly anymore. And when your heart's not beating, blood's not being moved, oxygen and glucose aren't going to the brain, and the brain's beginning to die. And within 4 to 6 minutes, there is some brain damage. By 10 minutes, the brain is pretty much dead. So the faster we can start CPR, the better the CPR, much more likely chance the patient's going to survive. Now, CPR just buys us time until the defibrillator gets there. If the defibrillator doesn't work, then we have to try other procedures, but that's way beyond a first aid class. Now, heart failure is when part of the heart muscle has died, and this is usually somebody has had a heart attack, although we also see this long term with someone that has high blood pressure. If the right side of the heart has started to die, and you see that that's darker on this image, the blood will back up, and it backs up into the body. So you'll see that their feet tend to be very swollen, and their neck veins tend to be bulging out a little bit, and that's a sign of a right-sided heart failure. There's really not any first aid we can do for a right-sided heart failure patient. Chronic condition, and they need to manage it with medications and with their doctor's orders. Now, with left-sided heart failure, here the blood will back up into their lungs, and when the blood backs up into their lungs, we end up with a condition called pulmonary, which means lungs, edema, which means swelling. And you've probably twisted an ankle or pulled a muscle and had some edema or swelling. Well, the same thing happens in your lungs. And when your lungs fill up with water, then there's no room for oxygen to get in there, and they actually can drown within their own fluids. So if somebody has and again, this is usually a chronic condition, so it's not something that's usually managed by first aid, but sometimes they can have a very sudden onset of this becoming much more severe. And about the best thing we can do is sit them up and call 911. Now, if they know they have heart failure and they take nitroglycerin, we can help them with that. If they're on home oxygen, we can try to increase the amount of oxygen, turning up the flow rate, and make sure 911 is called. Now, for high blood pressure, this is another chronic condition, so it's not really a first aid situation. We used to think uh, normal blood pressure was 120 over 80. They now want us to keep our blood pressures closer to about 110 over 70. We see less likelihood of stroke and heart disease if we keep it lower. High blood pressure is still defined as 140 over 90, and this is something that they'll have to talk to their doctor about, take blood pressure medicines, change their stress levels, exercise, diet, all that lifestyle stuff to try to make them healthier. But if the blood pressure does go up very, very high, it can cause severe headaches, blurred vision, dizziness, weakness, sometimes even nosebleeds. So if the blood pressure is that high, a lot of times they do need some medication, but most of the time, if they just call their personal physician, their doctor can tell them what to do. And to be honest, a lot of times it's just taking another one of their blood pressure pills. But sometimes it is real severe, and they might need to have it dropped a little bit faster. Although it is very rare that we need to go to the emergency department for this, I would recommend that they call their physician. But if that's not going to be a quick answer, maybe they can go to the emergency department and get this treated a little bit faster. So an aneurysm is when we have a bulging in the side of one of our blood vessels. And a lot of times this happens when there's a branch to our blood vessels. And this is something that sometimes people are just born with. Sometimes it develops because of a high blood pressure, but it's just kind of a weakening or a bleb. If you've ever seen maybe like a hose that started to bulge a little bit before it burst. Well, that's what's happening to one of your arteries. If that aneurysm bursts and ruptures, then we have massive bleeding depending on the size of the artery. If this happens up in the skull or in the brain, we call it a stroke. This can happen to the coronary arteries going to the heart, in which case the heart muscle begins to die, and then we have that called a heart attack. Another place that we see this a lot is happens in the abdomen because we have a lot of branching of blood vessels there, and that's called a triple A or abdominal aortic aneurysm. And when that bursts or ruptures, it's almost always fatal because they bleed out very, very quickly. So I hope that's a little bit of information about heart attacks and chest pain and acute coronary syndrome. Remember to have the patient sit down, call 911, and if you think they're having a heart attack, give them 4 baby aspirin or 1 adult aspirin. And as I said, make sure 911 has been called. And if you're ever in doubt, call 911 and let the professionals come out and assess the patient. A lot of times they can help convince a patient that may not want to go to the hospital that they need to go to the hospital. So let me know if you have any questions.